الله، معكم أخوكم محمد فلاحة من سوريا، مقيم بإسبانيا ببرشلونة بجامعة الويك. بشتغل في الجامعة كمدرس بالماستر تبع الاستاتيك والريستوراتيف، وعامل كمان الماستر. صراحة أنا بتشرف أكون معكم اليوم بهالبرزنتيشن، وسلامي لأهل غزة والرحمة على الشهداء، ويا رب هيك نرجع نشوف غزة شامخة بيناتنا. So, today we want to share the topic about managing diastema in anterior teeth with direct composite. During the presentation, we go through, first of all, definition. What does mean diastema? And then we want to know the etiology and the diagnosis, and then we choose the treatment plan. We have different options to do the treatment plan. So we should first of all understand the reason in order to go for the treatment. So the definition, it's between the space in the anterior teeth. It's very unpleasant and may result from development, pathological or heterogenical factors. It means that any space between anterior teeth, we can call it diastema. Maybe pathological, the people born with the diastema, or some because of the treatment or bad habit. So now I want to share some reasons. For example, frenulum. Some people burn with the frenum between the anterior teeth that affect the position of the centrals, or bad habit for the young people. They thought the finger, or maybe they push with the tongue their teeth because they have bad they sleep with the open mouth, and they just can take a respiration from the mouth. Or maybe conoid laterals, because we have unnatural shape to the laterals that keep the space between the lateral and central, and between sometimes lateral and canine. Or we have extra teeth, it's called mesodense, between the centrals that affect the centrals. So for the treatment option, guys, we have multiple options. We can do it between manage the closing diastema with the orthodontic treatment, with the crowns, with the composite, or veneers. Honestly, crowns, I see it so aggressive in some cases, so I don't prefer it that much. Ortho, we choose it when we cannot make the teeth more bigger, because we aesthetically not acceptable, so we should move the teeth. So first of all, our diagnosis is so important in order to choose the correct treatment plan. So we should do analysis to the teeth through our softwares. For example, we can do it with the Keynote, PowerPoint, or in the digital way like exocad. We should study the dimensions of the teeth in order to see if we can put composite or not. So today mainly we want to speak about the composite, because it's the most safe treatment plan for the anterior teeth, and we have a good results. People like it, and we can have it for long time. So here we have an example. If you see with me the centrals, so we have wide centrals. If I put more composite, or imagine crowns, maybe if I wanna choose crowns, so I should prepare a lot. Or if I wanna do composite or laminate veneers, so I will have two wide centrals, and that not be aesthetically. In this case, our treatment plan should be mainly focused in ortho. Okay, another case we can see. So we should here this case we can see, for example, when we want to analyze the centrals, we can just draw some lines to see how much I should add composite, and that will be aesthetically or no. Something you can do it even with your phone. Just take a picture for your patient's smile. Now I want to share 3 clinical cases that patient come to me and said, I want to close the space between my teeth. So these three cases, they have the same main chain of complaint, and our treatment, it was the same with with the composite, and but with different technique. So today we want to learn how I can apply my composite to close the diastema. We can see here we have three clinical cases with a smile. Let's start with the first one. Patients come to me after treatment of the ortho and still have the space between the centrals. So I do analysis first of all for the static in order to see the inclination of her teeth, the zenith point, occlusal plan, gingival plan, in order to see. And then I will do my study to see the dimension of the teeth. We can check we should measure the length and the width of the each tooth in order to see the dimension. And as we know, we have the golden stand between 75 to 85% of the dimension. So here we can do a little bit enlargement of her teeth. Here we have the golden percent of between the men and women. So we do panorama to check everything. We do preapical to see the position of the bone, and pituitary to check if you have any caries. So the problem that we have a little bit gummy line smile. We have shifted for the midline, diastema, and our treatment option, we check it all. So maybe we do ortho or gingivectomy or teeth whitening and composite. So in this case, we choose bleaching plus composite. Okay, so we do more. First of all, we do wax up to see the final results. So here in our model, we do wax up in order to see how should be the last results. Okay, then we copy all this information through silicone key. We apply it to the patient's mouth to check the aesthetically how should be. Here I will mention we choose acrylic material like ProTemp. So in order to do more or less a prova and tell the patient like if she like it or no. We do our pictures. We check the canine, all the occlusion movement, canine guidance, anterior movement. So for the bleaching, guys, as we know, we have home bleaching and we have clinical bleaching. In this case, we regarding to clinical and systemic reviews, we take the home bleaching. Why? Because they said the result will be the same, and for the home bleaching the sensitivity will be less. We take the first of all the primary color, and then here we check it the color after 2 weeks. And as we know, we can do home bleaching between 2 or 4 weeks. So we take the photo as well with the white and black in order to check the value, and we can see, guys, how much we improve. More or less with the bleaching we can improve the tone between 1 or 2. And then we start to do our composite. Depending for the brand that you are working, guys, you should do like this. In order to check the color of the composite, we use technique, layering technique, and we take the color of the dentine and enamel. So we do like a small ball in the tooth, and we take picture In order to check the color, so in our case we take enamel number 2 and dentine between 2 and 3. So our procedure start with the isolation. In order to be everything clean, we apply acid for 30 seconds, phosphoric acid, then adhesive with it 20 seconds, and then, as we said before, we use our silicone key to transform all the information in the model to the mouth. So we place the composite and then we start to do it. First of all, we do the palatal wall in the first picture on the left with the enamel. Then we applied our dentine. So we choose two color dentine because of the cervical part and the then incisal part. And then after we finish our centrals, we do our laterals. The same procedure. Here I want to mention we applied the transparent silicone in order to have the contact point interproximal walls. And then we do another lateral, the same procedure, apply acid, adhesive, and we start to create the palatal wall, then inside interproximal walls, and then buccal walls. You can see here with me. So here why I use matrix. If I don't use the matrix, I will have composite bonded to another tooth, and we close all the interproximal walls, and the patient can't use a dental floss. After we finish that, we should start to do our shaping and polishing. We know composite, it's easy material to handle, but we should understand the material in order to have more good result. So first of all, we remove all the axes and we start to create our anatomy. We use the diamond burr, and then we use the rubber with a low speed in order to give it more aesthetically way. And here we draw these lines in order to have it more aesthetically. So we start to evaluate the result, and then we do polishing. Sorry. Sorry, we continue. And then we do our final picture, and here we have the laterality, right and left, and then we do the final pictures for the smiling, and we can see the results. Patient so happy, and here we have before and after with a smile, and we can see the difference with the patient. We can evaluate the length of the tooth, we can check, we improve all the color of the teeth thanks for the bleaching. I recommend always when we do something in anterior teeth, we should offer the patient the bleaching, home or clinical, doesn't matter, but we can improve the general color, and we can see from the pictures in the after how we can plus the interdental floss. Okay, so now we move to case number 2, and here patient as well, she has spaces between the centrals and laterals. So, and I know it's a little bit small, but the patient doesn't like it. Okay, so in the master always we do some evaluation with pictures. So guys, my recommendation when you have any static case, you should do picture for the smiling, for the extraoral face with the smiling and with the reposition, rest position, and then with the interproximal pictures, always we should evaluate the occlusion. Why we do evaluate the occlusion before starting? In order to not have any problem after the treatment, because sometimes if we have bad occlusion or malocclusion, so we need to do ortho treatment to correct the occlusion. Okay, so here with that picture, also I recommend to do it, we can see the spaces. Always guys should do panoramic to check the general teeth, and after that with this picture we can see the axial line of the anterior teeth with, and also we can see the net point with the black point in the gingival wall. Even we can see here the percentage of the teeth. We do our wax up, mock-up. What does mean mock-up, guys? Mock-up, it's like our wax up work. We do silicone key, then we transfer to the mouse in order to check the aesthetic results. And here we do isolation. We start our acid, adhesive, and then we put our matrix. Here we use a special matrix, celluloid one, in order to close it, and we place like of them in order to keep it in their mouse. After applied composite, we should do all these steps. So we do composite first. After that, we should use diamond burr to remove the excess, soft latex to make the composite more polished and beautiful and more aesthetically, polishing paste to give them the brilliant, and here we can see the results. And this before and after, patient happy, we are happy. It's the same procedure. We didn't change the shape of the teeth, just we close the spaces, and we try to give the patient good results. And we should check our occlusion from the palatal wall, and check our interproximal point with the dental floss to see if everything is correct. And here guys, our last case, patient after ortho treatment. If you can see with me, we have just small black triangle between the centers, and our patient, she likes lots, she has high diamond aesthetic, and she doesn't like these small angles. So for us it's a little bit small, but for her she has problem with that, so and we should solve it. So my recommendations guys for the uh, protocol of the picture, first of all we should guys do a picture as you see here with a smile, all the face, and then another picture close to the hair smile in order just to have the teeth, and then with the separators in order to see all the teeth. And we check her smile in order, why we need picture with a smile, in order to see when she is smiling how much she show the teeth. And then our evaluation for lower and upper. Here we do like a Brazilian style. We open the rubber dam, we apply the acid adhesive. Here we use a metallic band. This one we use it for posterior teeth, but we choose this one because the space is so small and we need to try a little more cases. So my recommendation guys, when we have this type of diastema, we first of all we close the first central, then we move to another centrals, and here the results. You can see we close it all, just keep this small space that the gingiva will go down in the future, and we use our polishing protocol. We use this burr with the rubber dam. Sorry, it was this uh, gum. And here we use this type of polishing burr in order to give the beautiful texture of the composite. And here we can check the polishing paste. We apply this paste, and then with this pair have like a hair, we apply it in order to give it the brilliant of the composite. And then we apply another paste with the, here we use system polishing paste with the three colors A, B, C, and because to give them more aesthetically part. And we have the last results. You can see the smile, patient happy, and we are happy. This before and after. Also we should here the after in the left side, and in before in the right side, just to check with me. Yeah, we have the space closed. Yeah, here the pictures. Patient happy with a smile. And now for the maintenance. It's so important, guys, when we do composite, so we should do polishing, and we do maintenance every 6 months. Composite have some disadvantage for chipping, color change, and wear. Color change depending for the alimentation, for the cafe, for the tea, and for the depending how, and for the smoking. So we should tell the patient no white, no cafe, no color food, drinks, smoking. All this affect our restorations. And thank you, guys. This is my Instagram and TikTok. I am Muhammad. It was my pleasure. See you for the next class.